This is our COVID Roundup and CDC update for April 26th, 2024. Since last week, we're down about 14% in new hospital admissions due to COVID, and we're down about 10% in deaths due to COVID. Putting this into context, we've had 10 straight weeks of hospitalization decreases from COVID, and 11 out of the past 13 weeks have had COVID death decreases. It is very important to note that the new hospital admission number is one that should be suspect, as by the end of the month, within a couple days, hospitals will no longer be required to report COVID hospitalizations to the CDC. This is due to the end of the public health emergency. They set this deadline last year, and several states have already opted into ending this reporting early. Next, looking over to our genetic surveillance of COVID, it is finally updated, where 9 of the subvariants of JN1 have now been added to the list, and KP2, as we had been mentioning from Raj's tracking, is now the leading variant. And I just want to emphasize that scientists do know what they're talking about. We were able to predict this about a month ago, that KP2 was the one to watch. And JN1 is down to about 22% in proportion to the other variants, so that one is headed on its way out. And we're back into a time of quote unquote variant soup. But now we're in a very interesting situation where we have the JN1 side lineages and the XBB side lineages, which are two very strong, very distinct populations. So recall this is our Pango lineage chart, where we've entered a new stage in our pandemic where we have this XBB umbrella grouping as well as this JN1 umbrella grouping, which is two distinct lineages. So before I was like, I'm not sure what our next stage of the pandemic is going to be. Well, I think this is our next stage where we have two very large groupings. It's like how we have influenza A and influenza B. But the problem is that these are highly mutacious, or I guess mutagenic viruses, which can easily recombine and even back evolve. So I think what we're going to see is an explosion of new variants occurring. And these new variants are only going to be occurring faster and faster and faster at this point. So as we've been dutifully following Raj's data, you might look at it and be like, well, why is Raj's data so different? So it's not so much that it's different, it's that he's working with a smaller data set. The CDC has much more access to data all over the country than Raj does. So this is representative to what he is looking at. So he gave us the early trends. We were able to pick up on these things very quickly, while the CDC gave us very delayed trends. But that's the short answer of why it's different. It's because the CDC is looking at a much larger data set. Now, moving on to our New York State wastewater map. While last week it was not updated, it did update one time this week. However, because of this slowdown in reporting, I am concerned that this might become the new trend for New York. But regardless, as a reminder, anything that is dark blue is low levels of COVID in the wastewater, anything that is light blue is moderate levels, and anything from yellow to bright red is high levels of COVID in the wastewater. For all reporting wastewater facilities, last week they were at about 48%, or I guess 2 weeks ago they were at about 40% at the high levels, and currently they dropped to about 42% of all reporting wastewater facilities at the high levels, where the majority are sitting at the moderate level. Next, moving on to wastewater scan in California for the 58 reporting wastewater facilities. In California, we're still seeing early trends of it heading up, of the wastewater levels increasing. And this is even more apparent if we look at all reporting wastewater facilities to wastewater scan. This is 194 facilities throughout the country, where we have very clear signals of an increasing wastewater concentration for COVID. So we are heading back up in terms of COVID in the wastewater.